Okay, so we have, she has a British accent today, I don't know. So we're doing stool digit stimulation and sputum.
Shelly, this is my no, Abby. Don't you laugh at me?
Okay. So stool is a bowel movement. Through a bowel movement, many observations as well as tests can be done. Now, our responsibility as a CNA is to observe the odor, consistency, amount, color, and character of the stool. Anything abnormal needs to be reported. If any blood, mucus, or parasites are seen in a bowel movement, we need to report to the nurse in charge as soon as possible. Now, it's our responsibility to collect the specimen when ordered. Okay? Now, the steps to do this, I'm going to be showing you how to do it step by step. So you carry out the initial procedures, you knock, introduce yourself, make sure it's the right patient, and let the patient know the procedure we're going to do, okay? So now, this is the equipment we need, the tongue depressors, the biohazard specimen bag, which I left over there.
We have it drawn on our poster. I did not trace it.
Yeah, we have one here too. Okay, so now we use bedpan if they can ambulate to commode or to the restroom, but we can also do it in the bed, help them. And we can just put this one in here. Like I said, it's that's for here and going that. It's for the stool. Okay, so help the resident into the commode, and we have to label this. Make sure it has the right labeling. So we can get this one off. And it has the patient's full name, the room number, date, time of collection, physician's name, and the examination to be prepared. Of course, you have to wash your hands, put your gloves on. You come right here, and you have the stool right here. You have to have some kind of barrier where you can put this. You have your gloves, have it open. Now you collect the specimen, the tongue depressor. Okay, I believe it says,
You usually take it in the bathroom and do it.
yeah, so you take all this to the bathroom to it, or just?
Well, I would carry the
you
bedpan
take this
or
and cover it?
Yeah. Well, that would probably be in the bathroom if they're in the toilet. But if it's in the commode, I would just cover it and do it in the bathroom.
Okay. Alright, so this would be covered, so you just collect it and you put it inside. You close it, make sure it doesn't contaminate the inside. Like her procedures never contaminate the inside. As you grab the bag here and you have a smaller bag, so you put it inside. It's one of like this kind of, the smaller versions. You have a little precision paper that goes on the side and you close it, and then it's the facility procedures wherever you need to take it. So that's for the stool.
Now, what are some of the tests they run for stool collection? Like a stool culture, what else do they do?
I don't know, but you can check just for
They check
inspection.
for like ovum parasites, stool OB, stool called blood, where they have the little kits, and I'll show you later.
Isn't it, the blood on stool is called
No, it's not normal, right?
melena, right?
No.
Is it
If it has
melena?
blood, mucus, or parasites, it needs to be reported. If you see anything in the stool, you must
So you could
report
collect
to the
it
nurse in charge.
to rule out C. diff, if they're questioning ovum parasites, even just a routine culture to see what's growing inside.
Yeah. Okay. So that's for stool. Now, for sputum, it's a specimen brought out from the lungs. It's not saliva. You need to assemble all your equipment also. You start by giving them a little bit of water. They have to empty it into the emesis basin. Like I said, it has to be specifically brought out from the lungs. With this specimen, a microbiological investigation of respiratory infections can be made. It's within our scope of practice, but sometimes they can't bring it out from their lungs, so then suctioning needs to be done, but it's not by us, it's by the nurse.
or the respiratory therapist?
For them. Okay, so like I said, you have to first give them a little bit of water so they spit out everything they have watering out in the MS's basin. You grab another one, same information, everything you need right here, and then you have to make them cough it up, just cough up from the lungs. They throw it in here. Make sure you don't contaminate anything else, and you close it. Same procedures as this one, but you have to collect 1 to 2 teaspoons, of sputum, unless otherwise ordered. And okay, so then you have to place this in the bag, and like I said, you just do whatever the policy of your facility is, or where you need to take this. Well, that's the one for sputum, and you will do a digital stimulation.
Now sputum, we do culture and sensitivity to see what, if there's bacteria growing in the sputum, and